Good afternoon and welcome to our live stream edition of our class, Optimizing Pelvic Health in Pregnancy and Recovery. My name's Christine King-Burke and I'm a pelvic health physical therapist and clinical supervisor for the Hoag Pelvic Health Program in Newport Beach. And this is my colleague Kathleen Lombardo. She's a pelvic health physical therapist, clinical supervisor for the Hoag Pelvic Health Program in Irvine.
Welcome. So we're going to go ahead and talk about the outline for the class, just so you have a little roadmap of what we're going to talk about. So this slide will be up. We've organized the class into two different sections. So one is during your pregnancy and the other one is after your pregnancy. So as you're going through your pregnancy right now, your body is going through a lot of changes and your pelvic floor muscles have to keep up. And so we're going to talk about preparing your pelvic floor. We're going to talk about specialty strengthening and then also specialty stretching and relaxation of those pelvic floor muscles. They are muscles, so like any other muscle in your body, we need to balance strength and flexibility in those muscles. And so pregnancy and vaginal delivery is actually one of the best circumstances to discuss strengthening and stretching both. All right, and then after your pregnancy, we've organized it further into talking about the first 6 to 8 weeks, and then we're gonna go into 6 to 8 weeks after, because they're gonna look a little different in our recommendations. We're gonna talk about back care, bladder health, bowel health, and sexual health. All right, and talking about bladder, bowel, and sexual health is a little bit self-explanatory, I guess, right, in talking about the pelvic floor issues. And we just want to touch on why we're concerned about back care and why we actually put a little emphasis onto that in our class. I'm going to do a little demo with our balloon just to show you what your trunk is like, what your core is like. So you have your diaphragm here at the top, your pelvic floor at the bottom. And then I'm going to turn it sideways. Your abs are going to be in the front and then your back here. So in pregnancy, there's a little bit of an imbalance in this core system where your abs are distended, your diaphragm's shoved up there to make room for the baby, your pelvic floor is working hard. And so what we see is that if we don't touch on back care at all, if we don't touch on your core, we'll see some pelvic floor issues creep up. Sometimes whether it's continence issues or even pain, because if none of the other ones are working properly, then your pelvic floor is going to have to carry the load. So just keep that in mind. Sometimes it can get confusing why we talk about back care so much, but it's a big piece of the puzzle in pelvic floor function. All right, next slide, please. So we're going to look at the anatomy. Sorry, I'm just going to grab the pelvic model here. All right, and you have the pelvis here with our pubic bone here in the front, and then your tailbone in the back. Tailbone is the end of your sacrum. And then you have two bones right here, your ischial tuberosities. So if you're sitting on your seat right now watching us, you could place your fingers underneath those ischial tuberosities and kind of sit on it. And your pelvic muscles is everything right here. They live in the middle of those bony borders. And so what we'll see, the pelvic floor has different layers to them. The clitoris would be right up here. Urethra is here where the urine comes out, so important for bladder function. Vaginal opening, and then anal opening, and these are the nerves. So in terms of function, so we have sphincteric is our first function, and that means that your muscles close and open, right? So that I don't pass gas if I don't think it's appropriate. So I don't pee or poop, right? On the way to the bathroom, I can hold that in. And then once I get to the bathroom so that I can urinate and have a bowel movement without pain, without straining, and and pain-free. So that's all sphincteric. The second function would be sexual. So those muscles contract and relax for sexual function. Orgasm is a rhythmic contraction and relaxation of those muscles, and those muscles have to be flexible for sexual function to be pain-free. The third one is supportive. So supportive meaning our pelvic floor is that floor of our whole canister, and it supports our organs. So our organs are right here. So your bladder, your uterus, your rectum, and then all of your intestines. And if I tilt this, so you'll see a bowl of muscles right there. So they all support all of those organs that are held in our abdominal wall. And then the last one would be stability. So I've touched on it a little bit. Your pelvic floor is part of your core, and my colleague is going to talk about that in more detail in the coming slides. So we'll go back to the slideshow.
Excellent. So now that we're back in the back into the slide deck here, so that those of you viewing from home can kind of see the points that we're making here. The first thing that we're going to touch on here is going to be talking about perennial preparation during your pregnancy. So one thing that we're going to touch on, and we always kind of make this promise when we have this class, but we will most certainly make sure that by the end of today, everyone is very, very comfortable with doing a proper Kegel. So for those of you who don't know, a Kegel is kind of the fancy term for how we contract our pelvic floor muscles, right? So Kathleen did a beautiful job going through our anatomy. And so we're going to learn today how we can contract those muscles. And the reason that that's important is because Kegels will increase your awareness of your pelvic floor muscle contraction as well as relaxation to help prepare you for labor. Kegels can help you to prevent urinary and fecal incontinence. And whenever we talk about Kegels, we always want to talk about how many we should be doing. So oftentimes when we start talking about Kegels, we will hear from people, you know, I really wanted to get ready for my delivery, so I was doing 200 Kegels a day. And it's really important to remember that like any muscle group, you can overdo it with the pelvic floor. So you really want to stick to around 60 to 80 Kegels per day. 80 would be the maximum, and 60 would be the minimum for actually making change within the pelvic floor muscles. So as far as mastering the Kegel, so let's work on mastering, right? So we always tell people you want to imagine that there's a zipper that runs from your anus up to your pubic bone. So when you are thinking about actually contracting your pelvic floor, you want to start at the back of the zipper, back where the anus is, and draw up and in, trying to draw that zipper closed. And I know we're probably all practicing it right now as I'm talking about it. It's okay, we are too. So you want to think about squeezing like you're stopping the flow of urine or stopping the passage of gas. You can think about pinching the labia together and pulling up and in. Draw the sensation within about 1 millimeter of the pubic bone. And you really, the important kind of thing to mention with Kegels is that they absolutely should be pain-free. So if your Kegels are not pain-free, you'll want to stop and talk to your OB about it. That can signal a number of different issues going on with the pelvic floor that you definitely want to get addressed. So again, so let's all, while we're at home, let's all practice the Kegel together. So I want everyone, wherever they're watching this, I want them to sit up nice and tall, put both feet on the ground. We're going to inhale together. So inhale, draw a breath in, expand the belly. And then as we exhale, we're going to draw up and in at that zipper. And then inhale, relax. And exhale, draw up and in at that zipper, okay? From a seated position, you may not fully feel your pelvic floor activating, especially those of you that are a little bit further along in your pregnancy. You're contracting against gravity, so it's a little bit harder. You can always, to eliminate gravity, you can always try going to kind of a semi-reclined position and trying that way, and you may better feel the Kegel. Okay, so as far as strengthening goes, we want to do a couple different versions of this. So first would be the slow Kegel, where we're contracting our pelvic floor muscles, holding for 10 seconds, and then relaxing for 10 seconds. So that when we talk about a slow Kegel, that's what we're talking about. We can look at doing quick Kegels, where we'll contract and hold for 1 to 2 seconds, and then relax for 1 to 2 seconds. We want to look at functional Kegels, so that would be before changes in position, before you cough, before you lift something heavy up. That's a functional Kegel when you're actually using your pelvic floor to support that movement. And in an ideal scenario, for those of you who haven't really been doing any kind of pelvic floor strengthening, what we want to look at doing is doing 3 sets of 10 quick and 10 slow Kegels per day. That would be 60 Kegels. And then looking to work in some of those functional Kegels throughout the day. So looking at if you're going to pick something up that's heavy, looking at engaging the pelvic floor. We always like to say, if you know you have to sneeze, squeeze before you sneeze. Sneezing can put up to 70 miles per hour of downward force on the bladder, so very, very common to lose a little bit of urine with a sneeze. But if you contract your pelvic floor prior to that, it'll help to kind of support the urethra. And so last little bit here on mastering the Kegel is that we want to be sure it's extremely important to relax and lengthen your muscles after each contraction, right? So think of how you would feel if you constantly clenched your jaw and you didn't relax. You would start to get a headache towards the end of the day. The muscles would be really fatigued. So same idea with the Kegels. So just because you're doing 3 sets of 10 Kegels, we want to fully relax in between, right? Just like any other exercise. And it's really important that these exercises remain pain-free. There are times when muscles are too tight and need lengthening as opposed to more strengthening. And last but not least, we want to be sure that we're also not holding our breath when we're doing the Kegels. So last kind of important point that we really want to touch on here when we're talking about muscles not just being for shortening, right? So we said it's really important to lengthen and relax your pelvic floor muscles in between. We want to be sure, so muscles are not just for shortening. Remember that muscles have 2 purposes. The first purpose of the muscle is to shorten and to tighten and to produce movement, but they also have to be able to lengthen and to stretch out and to control movement. Every muscle in our body has an antagonist, and what that means is that when one muscle is shortening to produce movement, the antagonist muscle is lengthening to allow movement. So for your pelvic floor muscles, its antagonist is your diaphragm, right? So Kathleen went over that beautiful demonstration of the core muscles with showing that the diaphragm was actually a part of that. So when you actually fire your diaphragm, remember when we practiced the Kegel, we took a nice inhale and made our bellies expand. You're actually firing your diaphragm, which forces the pelvic floor to drop and relax a little bit. So a proper Kegel is not just a full pelvic floor contraction, it's a full pelvic floor contraction followed by a full pelvic floor relaxation, and that would be a full Kegel.
All right, so next up in perineal preparation would be relaxation. And so if you're going to deliver vaginally, a soft and relaxed pelvic floor can allow for easy passage of the baby when delivering vaginally. And if the muscles are tight, the skin over those muscles will tear if there's no give into the tissues in the perineal area. Now, there are many different schools of thoughts, in terms of pushing. There's, inhale or exhale, different types of breathing, different positions. There's even hypnobirthing, all up in that prep for birthing. And the idea, our goal is not necessarily to say one way or the other, but our goal is just to make the point that these muscles need flexibility to make a path in the pelvis for the baby to come out. So no matter how it is that you breathe, we say exhale or inhale, but the idea is that those muscles have to be stretched out, open. Sometimes when they say push, people will, push and push and push, and what they're actually doing is tightening in the pelvic area. So the idea is if you're pushing, the pressure should come from your abdomen, so diaphragm should come down, the pressure should come down into the pelvic floor, and your pelvic floor muscles should be lengthening to allow for the baby to come out. So at 6 months, you can actually practice with a little bit of pelvic muscle bulging exercise. So it's about 10 to 20% effort. It's not like you're going to push a whole lot at this point, but you could practice gently bulging the pelvic muscles. So imagine the vaginal area as a circle opening wider and wider, or a flower blooming. You can start with some breath sounds, your shush, your grr, your, And then one of the visuals is imagining an upside down umbrella, trying to open. Remember, they attach to your sit bones, so you could imagine your sit bones getting wider, your pubic bone and your tailbone opening in that area. All right, so practice coordinating your pelvic floor muscles with exhalation to prepare for the second stage of labor, facilitate vaginal delivery. So exhale to narrow your abdominal region while consciously opening the pelvic floor muscles. Hold that, relax, and then do it about 10 times. So this is sort of a reverse Kegel. So Christine talked about a Kegel, pulling up and in, and then this one is opening, inverted umbrella, opening the sit bones and the pubic bone from the tailbone. All right, and then as bonus material, in that third trimester, we like to introduce pelvic mobility and stretching exercises. We're gonna go over some of these exercises at the end. We're gonna demo some of them, but for now, we'll just talk about it. Why we talk about it? Well, your hip muscles, your hamstrings, your buttocks, they actually attach to your sit bones, those ischial tuberosities. They attach to your tailbone, your inner thighs attach to, your pubic bone. And so those bones actually transiently open up when you're delivering. And so if those muscles, those hip muscles are a little bit on the tight side, it'll be really hard to stretch that pelvic area.
Excellent. So last kind of little piece that we're going to touch on here in terms of talking about optimizing pelvic health during pregnancy specifically, before we move on to the postpartum period, last but not least, we're going to kind of talk about perineal massage. So the perineum is that kind of tough area of skin right in between the vagina and anus, and it's a common site for tearing during childbirth. So we will work with our patients sometimes on helping to kind of massage or stretch that area, and essentially just getting used to that sensation of relaxing the pelvic floor while there's a lot of pressure on the perineum, so that you're better prepared to do that during labor. So perineal massage can also help to train your pelvic floor muscles to relax. This is something that you want to start about 6 weeks from your due date. So the way that you'll kind of go about that is you'll wash your hands and lubricate your fingers and your perineum. Again, the perineum is that patch of skin between your vagina and anus. As far as what you can lubricate with, we typically recommend vitamin E oil, coconut oil, anything that you typically use as a lubricant would be fine. And you can position yourself propped up on some pillows. And essentially you want to gently hook the tip of one or both thumbs shallowly into the vagina. You're only going to insert up to about where the knuckle is in your thumb. For those of you that have zero experience with perineal massage, and this is your first childbirth, I would recommend just starting with one thumb just to kind of ease into it a little bit. So what you'll do once the thumb is inserted is you're going to gently stretch the thumb out and downwards towards either the left or the right of the anus. You're essentially going to stretch the perineum in 3 directions, straight down, down to the right, and down into the left. So it doesn't matter which direction you choose first, but you're going to pull, let's say, down into the right until you feel a sensation of a comfortable stretch. This shouldn't be painful, but a slight burning or stinging sensation may be normal the first few times that you do this. So you'll stretch down into the right and hold for approximately 60 seconds, which is about the average length of a contraction. And then you'll rest for a minute or two to allow the circulation to move through the perineal area. You want to focus especially on your exhale during this time to allow the perineum to comfortably and gently stretch with your thumbs, right? So as we kind of went over the different breathing mechanics, your pelvic floor naturally tends to kind of want to rise and tighten a bit when you exhale. And during this exercise, you want to really focus on, as you're exhaling, keeping the pelvic floor soft and relaxed. This exercise will help to train your perineum to relax on your exhale and with pressure to the perineum, which is going to help a lot during delivery. So again, as you insert the thumb, you'll pull down into the right, hold it for about a minute, then you'll pull down into the left and hold it for about a minute, and then you'll pull straight down and hold it for about a minute. Again, shouldn't be painful, but a burning or very, very slight burning or stinging sensation can be normal when you're stretching the perineum. It should get better as you go, but should not be painful. You want to spend about 5 to 10 minutes daily with this, beginning from about 6 weeks out from your due date. Okay, so that's kind of the conclusion of our during pregnancy portion. It looks like we're getting some great questions in the live chat there, so we will be sure that we go over those at the end once we go through our after your pregnancy portion here. So in terms of looking at after our pregnancy, so the goal, we're all pregnant, the goal is that we are delivering a happy, healthy baby, and now what do we do, right? So how does mom recover? So changes can occur in your pelvis to make room for the baby and to prepare for childbirth, right? Baby's growing in there. The muscles, nerves, and ligaments in the pelvic region may stretch or get strained during delivery. And as a result, it can be common for new moms to experience changes in bowel and bladder habits, sexual function, and core function, low back stability. All those things may change a little bit after you deliver the baby. So we want to kind of talk about what's normal, what's not, and ways to kind of troubleshoot common problems to optimize your outcomes. So first and foremost, kind of one of the important things that we want to touch on is looking at what's a normal pelvic healing timeline, right? So should we be back to running in 4 weeks? Should it take us 6 months? What's normal, right? So in that first 6 to 8 weeks following your delivery, your focus is just on healing and regaining daily function. So we're not necessarily pushing the activity level, but going for short walks depending on how you feel, getting back to day-to-day things around the house, caring for the newborn. That's our focus for the first 6 to 8 weeks, is just healing, letting those tissues heal. And then in 6 to 8 weeks and beyond, we're looking at a gradual increase in activity. Excuse me. So at this point, once we've hit the 6 to 8 week mark, we want to start to address any lingering incontinence issues. We want to look at regaining intimacy and regaining core function and stability by 5 to 6 months. So it may take up to 5 to 6 months before through your core you're feeling back to normal. And it's not uncommon to hold your return to sports or more intense exercise until 9 to 12 months. So, at the 6 week mark, if you're able to start exercising, if you're not exercising with the same intensity or the same difficulty level that you were before, that's pretty normal. It can, for some women, take up to 9 to 12 months to get back to where they were.
All right, so we'll go into more detail into the first 6 to 8 weeks. Okay, so for the first 6 to 8 weeks, what we want to really focus on here is just focus on healing. So it's time to rest, heal, and improve your awareness, connect to your body, your pelvic floor, your abs, and of course your newborn. Exertion should not be more strenuous than your daily activities and baby care duties. I mean, for baby care, you are squatting, you are lunging, you're lifting, so all that is good. Go out, get out and go for a walk. But what we mean is, probably not the best time to start jogging, doing crunches, planks, or, going back to some of those heavier activities quite yet. Abdominal binders can help in terms of supporting the core musculature as it heals, and it can help in reducing back pain. Research is mixed on that, whether, it will make my belly skinnier, the aesthetics of that. But from a pelvic floor PT standpoint, we like using abdominal binders just for that extra back support. Like say, if you had strained your back or something, just using those abdominal binders to help with movement. Some of the brands, not endorsing, but some of the ones that our patients have told us they love and that we love, Belly Bandit, Better Binder, the Wink, some of those things. Fit Splint, we use them during pregnancy and definitely still good postpartum. Or even your pregnancy belts, that have given you support during pregnancy. You can definitely use that during that first, 6 weeks postpartum. If you had a C-section, definitely, those binders help, or those pelvic support belts help because you are going to have a little bit more pain during that first 1 to 2 weeks. All right, we're gonna talk about, we don't have a slide on this, but I'm just gonna briefly talk about scar tissue. So if you happen to have an episiotomy, if you did tear, I mean, it's inevitable sometimes, you know, you can practice all you want, but things just don't go exactly as planned, and there could be a little tear, a little episiotomy on there. And so you could put an ice pack in that area, ice pack wrapped in washcloth to the area 20 minutes at a time. Just watch in terms of gentle Kegels. You could do that to reduce the swelling around the area. And then if you've had a C-section scar, you could place a pillow over the incision to support you while breastfeeding. If you've gone to the breastfeeding class, there's different types of baby holds, so maybe a football hold where the baby's on the side versus in front of you can help so you're not irritating the C-section area. You could place a little towel or a sanitary napkin on the scar when you're driving so the seatbelt doesn't cause you any issues. And then you could also start massaging the scar. I could demo again in the end. When we go through the exercises, we'll show you some scar tissue massage techniques that can be helpful during that time. All right, so off to bladder health during that postpartum period. So if you are experiencing strong sudden urges and you can't make it to the bathroom, so the one thing you want to do is just rush to the bathroom, but that's not what we recommend you to do. So we actually say stay still, and you could even sit down, put a little pressure on there in your perineum to get it to relax. Try and do 5 Kegels and then distract yourself until the urge subsides, and then slowly walk to the bathroom. So what we're trying to do here is you're just reestablishing bladder control, and that should return, you know, over time. It's just that when you get into some faulty habits, then it's a little difficult to regain those back. Also try to avoid consuming bladder irritants, meaning caffeine, alcohol, and other carbonated beverages. Doing the Kegels, you know, to suppress an urge, it's an inhibition. So like Christine had touched on, there's an antagonistic relationship. So your bladder is a muscle, and when it for some reason spasms or gives you a strong urge to urinate, your pelvic floor is the antagonist. So it's like bicep tricep, they can't be on at the same time. So if I do a Kegel, not only does it cause closure so I don't leak, but it can also send a signal to my bladder to tell it to relax and not give me those urges because they can't be on at the same time. All right, other tips: take your time emptying your bladder. Your pelvic muscles need to be relaxed for easy passage of urine. So we've practiced some relaxation visuals, so you want to make sure that you are relaxed and taking your time. A lot of times we just rush through it because we want to tend to the baby, or you know, we're just too busy, but you want to sit down, relax, and focus on releasing those muscles so you can empty your bladder completely. Do not stop and start your urine stream to do your Kegels. We've heard this before. Hey, you know, should I do my Kegels by stopping and starting the flow of urine? It's a good test to see, you know, are those my muscles? If I can stop it, then yes, you know, those are your muscles. But to Kegel, to stop it, is not a good practice because you want to respect that physiological function. So if you're urinating, they should be relaxed. If you're done urinating, then that's when you Kegel. All right, try not to go to the bathroom just in case, especially at night. Go when you need to go. So a lot of times, you know, you're breastfeeding, you're drinking a lot of water to make milk. The baby's, you know, gonna feed every 2 to 3 hours in that first few weeks. And then you're also drinking, then you're gonna go. So you're gonna change the baby, feed the baby, and then you're gonna go pee. And then later the baby's sleep trained and you're still waking up 2 to 3 times, you know, or every 2 to 3 hours. And a lot of that comes from bladder training too. Your bladder is a very trainable organ, and so you could train it to hold. Normal capacity is 400 milliliters, so that's 16 ounces. Your bladder can hold 16 ounces, and we typically feel that first urge to urinate at about 5 to 7 ounces, so 150 to 200 milliliters. We've had some patients honestly measure their urine just to see as they're reestablishing some of those functions, but just to give you an idea, those are what the norms are.
Excellent. So another big kind of tip for reestablishing that bladder control would be to be careful to not get constipated. A full bowel, can put pressure on the bladder, which can create urinary frequency and urgency. A full bowel can kind of create that sense of, oh, I gotta go right now. It can allow the bladder to not fill completely. So we do want to be careful to kind of manage that constipation, and then also keep in mind that straining to have a bowel movement puts a lot of pressure on your bladder support system. So if you're super backed up and you're sitting on the toilet and you're having to really push and strain to get anything out, it's putting a lot of strain on the bladder support system, which we definitely don't want. So if you are having difficulty emptying your bowels, a few different kind of tips and tricks here for happy, healthy bowel movements. First and foremost is really try not to strain. Straining has been shown to actually increase activation of the pelvic floor muscles, which can make it harder to get a bowel movement out. So we want to ideally, just like our gal in the photo here, she is using a squatty potty, and again, not endorsing, but squatty potty is fantastic for helping with optimal elimination. Our bodies, the way that our anatomy is lined up, we're kind of meant to empty our bowels in the bottom of a squat position. But modern toilets are a little bit higher than that. So what the squatty potty does is it actually allows you to bring your feet up off the ground. It gets your knees above the hips, and it mimics being in the bottom of a squat position, which allows your bowel to empty better. It also encourages your pelvic floor to relax. So just like the pelvic floor muscles have an inverse relationship with the muscle around the bladder, same is true for the bowel. So as your pelvic floor relaxes, it sends a signal to your brain that tells your bladder now is a great time to empty, and peristalsis kind of takes over from there. And it doesn't have to be a squatty potty. If you just want to try this out at home, you can put your feet on a stack of books or anything that basically gets your knees above your hips, and that would be great. So we want to take deep breaths as we're sitting on the toilet. On the inhale, you can imagine a widening of the hips, and exhale to relax and let go. While you're attempting to have the bowel movement, again, you want to get your feet up so that your knees are slightly higher than your hips. You want to think about consciously trying to relax your pelvic floor muscles. So sometimes we'll tell people as they're sitting on the toilet to think about your low back, hips, tailbone, everything kind of just melting apart into the toilet. And walking can also help to stimulate bowel movements. So if you're noticing that you're feeling backed up, remember gravity really helps. Get up, move around a little bit. Make sure that you're drinking plenty of fluids and consume a variety of fruits and vegetables to avoid having hard, lumpy stools. All right. And of course, in terms of kind of as we're progressing out of that 6 to 8 week mark, as we're looking at kind of being a little bit more active and regaining bowel and bladder control, remember that functional Kegels can be really, really helpful. As your body's still healing, you may find that you're losing a little bit of urine as you're completing these tasks. So one thing that you kind of that you can work on doing is practice Kegeling before and during any exertion. So Kathleen will touch on it a little bit more in our back care with newborns. But if you're looking at picking up the newborn, using the car seats can be a little bit heavy. Any of those can be a little bit exertional and can cause some leakage. So you can practice Kegeling before and during that task. Before and during any activity that causes leakage or vaginal pressure, okay, even if it's tying your shoes, moving from sitting to standing, rolling over in bed, if coughing causes you to leak, you can Kegel before and during that task. Kegel before and during the cough, and then relax. And we can also Kegel when getting up from the chair, lifting the baby, lifting the car seat, anything along those lines. So looking at kind of moving into looking at back care. So kind of one of the final pieces here that we're looking at. Of course, you've got your new beautiful newborn at home for you, and they just keep getting bigger and bigger, which is a great thing. But as your body's healing, it can put a little bit of strain on your back. So we do want to work on kind of how to support that. So remember that just like Kathleen talked about, your pelvic floor is a part of your core, right? So again, we often associate the core with just our abdominals. The core is actually a group of muscles, right? So it's our transverse abdominis, it's our diaphragm, it's our multifidi in our back, and it's our pelvic floor muscles. Back pain can be common as caring for the newborn is very physically demanding. Changing diapers, lifting, bathing, getting your baby in and out of the car seat can all take a toll on your healing body. And these physical demands coupled with stretched abdominal and pelvic muscles from pregnancy and delivery can lead to back pain and pelvic muscle issues. So again, going back to our core pressure system, just as a kind of reminder, if one wall of our cylinder, right, so we looked at our cylinder where the diaphragm was the top of it, pelvic floor is the bottom, transverse abdominis is the front, our intercostals and our ribs are the sides, and our multifidi and along our spine are the back of the cylinder. If one wall of the cylinder weakens and fails, the ability of the core to maintain tension and transfer forces is lost, right? So when we're going through our pregnancy, that front wall is starting to weaken. So when a wall of the core fails, it can manifest as urinary incontinence, pelvic organ prolapse. It can manifest as diastasis rectus, which is a separation of the abs, and it can also manifest as low back pain. So when we're talking about how we can kind of activate our deep abdominals and our multifidi together to kind of try and create this solidarity within the core, we tell people to imagine that there's a wire pulling the hip bones together. Okay, you can think about pulling your belly button in and lightly tightening your stomach. And one other thing that we typically ask people to do is to actually put their hands just above their hip bones and let the fingers sink in. And as you exhale and contract your abdominal muscles, thinking about pulling your belly button back towards your spine, as you do that, you should actually feel the muscles kind of tension underneath your fingertips. Okay. So looking at basic core recruitment so that we can all kind of practice this at home together. So I want everyone to, you can try it first in standing. So wherever you are, hopefully you're able to stand up. Go ahead and put your hands on your hips and slide your hands down and in a couple of inches, just like you're wearing jeans and you're putting your hands in your pockets. Keep your hands in this position for the exercise. Take a deep breath in, and as you exhale, contract your pelvic floor muscles and pull your lower tummy in towards your spine. Imagine that you're zipping up a pair of tight jeans. You should feel the muscles contracting underneath your fingertips. Go ahead and relax. And we'll try that one more time. So go ahead and inhale, and then exhale, lift the pelvic floor muscles and pull the lower belly in. Very good. Go ahead and relax. And we can keep these muscles contracting for a count of 10. As you're doing these, you do want to count out loud to make sure that you're still breathing. This is an exercise that if you're not careful, you may find yourself holding your breath. When you get to 3, see if you can pull in a little more, pull in a little more at 6, and then pull in even a little bit more at 10. And then once you get, or at 9, excuse me. And then once you get to 10, let everything relax completely.
All right, and as promised, we are going to touch on back care, and body mechanics is a big piece of that. So summarizing body mechanics principles on this slide, so keep the load close to you. So your load is your baby, or the baby in that car seat, or any other equipment. Avoid twisting, so turn from your legs and not from your waist. Do not slouch over while bending, so bend at your hips and your knees, separate your feet. This is when strong legs can come in helpful. Don't hold your breath, so we've practiced. Exhale and gently Kegel and pull your stomach muscles in during exertion. The ideal work height is at your belly button. So thinking about bathing, changing diapers, you're gonna do that many, many times in a day. Squat and rise, kneel and rise. So instead of bending at the waist, always use a squat technique or a half kneel and think in steps. All right, going through some of the lifting techniques. So lifting the baby, hold your baby in front and center most of the time. Scoop your baby from the bottom rather than picking up under the arms. Pick up your baby gently. Pick up your baby, of course, gently, but gently exhale to pull in and lift your pelvic floor muscles and your abdominal muscles. You just practiced that with Christine, so you're gonna go ahead and try and do that when you pick up your baby, keeping your back straight and moving from your hips, not from your back. All right, so lifting, use a squat or a half kneel technique and break things down in steps. We will demo at the end here just to so you can be clear on what we're talking about. Ideally, you should limit lifting to 25 to 30% of your body weight to prevent the strain on your back. Stroller squat technique, again, is going to come in very important. You know, we're going to put that baby in and out of that stroller. Exhale and pull your pelvic floor and your abs in on the effort. There are excellent car seats and strollers out there. We see some of our patients will bring their car seat in. That's a little heavy. So we suggest that, you know, if it's a car seat that has an adapter, you know, you put the car seat in the stroller and then stroll it around instead of carrying that car seat with you. Exercisers or swings, there's a lot of different, you know, swings now, more fancy and less bulky, so it's actually easier on us to put the babies in there. But again, squat or kneel on one or both knees to get the baby in and out. You can even try sliding the baby from behind. In terms of feeding, breastfeeding or bottle feeding, you want a high back chair with a lumbar cushion, a lap pillow for the baby. Bring the baby to you and not you to the baby. They mentioned this in the breastfeeding class as well. So if your feet don't touch the ground, you want to put a footstool on there to help with your back. Changing diapers, don't do it on the floor. So rest, you know, your front of your pelvis against the table. Belly height, again, is ideal. So you don't strain your back. Bathing, it can be hard on your back if you're leaning over into the tub, you know, to bathe the baby and as the baby grows. So bathe the baby in the sink for as long as you can. They have those little tubs that you could use. Again, the sink in your kitchen or something is pretty much belly height, so that's what we suggest. And then once you're ready to do the baby's bath in the tub, then we suggest get in the tub, you know, be inside the tub so you're not reaching over. And picking up the toys, go on your hands and your knees, or a golfer's lift, so you don't have to always bend and strain your back. All right, additional tips we just want to touch on in terms of carriers. There's different carriers out there. Front slings and front packs are great. You know, it keeps the baby close to you, so we love that. And it's centered to your body. But we have seen some, you know, improper uses of those carriers. So the shoulder pads, we like wide strapped shoulder pads to spread the weight. Adjust them so that the baby's buttocks align with your waist. So not too high because it'll be strained on your back and your neck, and not too low either. A backpack, find one with a hip and a sternum strap. You're probably not going to use a backpack for a while there, but just in case for future, we want to tell you all of those. All right, carrying the baby, front carry, it is comfortable, but watch your tendency for excessive toe out and to avoid rounded shoulders. Engage your core. You can imagine a straight line connecting from your ribs to your pelvis. So this is a good chance for you to start engaging your core and not leaning back, you know, into bad posture. Hip carry, that's great, but sometimes, you know, patients will come in and we're like, oh, you carry your baby on your right side, and they're surprised of how we know, but their right hip is all hiked up and their shoulders are up. So it's a good idea so that you can free one hand to do something, but not good for traveling a distance. And be careful, you know, with that cocking of the hip out. So switch from hip to hip and try not to get too attached to one side there. All right, and like we said, it is physically demanding and a lot of forward activities. So we want to say, please stretch, you know, after long sessions of nursing, carrying baby before getting going to bed. It'll help just relieve some of that built up tension and correct some muscle imbalances there. Again, we'll demo some of these stretches at the end.
Excellent. So moving on, we've kind of covered where your focus should be for the first 6 to 8 weeks and kind of things to keep in mind in terms of your healing. So moving beyond the 6 to 8 week postpartum period, so as you're progressing back into whatever you were doing prior to delivery or prior to pregnancy, and how you can kind of continue to support your healing during that time. So first and foremost, if urine leakage persists, the most important thing that we can tell you is to not be discouraged. When we're talking about urinary leakage, we really want, especially after a childbirth, we really want to differentiate between common and normal. It's very, very common to have urinary leakage after delivery, but it's not normal. So normal would mean it is what it is. You just kind of have to live with it, and that's not true. It's not something that you have to live with, and the urinary leakage is typically coming from some sort of dysfunction within the pelvic floor muscles or within the core muscles in general. And the one thing that we know about muscles is that you can most certainly make changes in them by strengthening them, lengthening them, whatever it is that you need. So don't be discouraged. It's common, but it's not something that you have to live with. You want to go back to resuming strengthening of your pelvic floor muscles by doing 60 to 80 Kegel exercises per day. So again, sometimes when we do have urinary leakage, the natural tendency, I'm going to do 200 Kegels a day and I'm going to get better a lot faster, and we want to be careful not to do that. So 60 is our bare minimum every day to really create changes within the muscle and to truly strengthen the muscle. But 80 would be the max, so we don't want to go above 80. And again, as you're easing back into that, you want to do a combination of slow, quick, and functional Kegels. So some sample exercises that we have with that, remember we went over the slow Kegel, where we'll contract and hold for 10 seconds, relax for 10 seconds. We want to do our quick Kegels where we turn the muscle on and off as fast as we can for 10 sets of 10. You can also do elevator Kegels. These work on our motor control. So you turn the muscle on, but not completely on. You just turn it like 50% on, then go to 100%, and then back down to 50 and then off, right? So working on that kind of motor control. The pelvic floor is a core muscle. It's active as you're up and moving around and you don't even realize it. You've been doing Kegels your whole life and you didn't even know it. And so as you're moving around, the muscles are turning on, and muscles shouldn't turn on 100% all the way or not at all, right? We do have varying degrees of strength or varying degrees of contraction that we use in different situations. So we want to start to kind of train for that a little bit. You can Kegel with coughing, with squatting, with lunging, with bicep curls and rows, standing on one leg. You can incorporate Kegels into any of your gym exercises. Just keeping in mind that during the exertion of the movement is when you should be tightening the pelvic floor. So if you were going to incorporate a Kegel into your lunge, you would want to relax the pelvic floor as you're bringing your trailing knee down to the floor. And then once you go to stand up from that position is when you'll fire the pelvic floor and contract. And again, being careful to stick within that 60 to 80 total repetitions per day. Our goal ultimately is that we want to train these muscles in different ways to create a motor program and the body's muscle memory, right? So all of our muscles have memory, and the more that we start training our pelvic floor muscles as they're healing, the more that we train them in different ways, the more that our body kind of remembers, oh yeah, this muscle's supposed to help us out a little bit with our squats. This muscle is supposed to fire when we're lifting something heavy. You'll need these exercises as a foundation to succeed as you increase your activities further into your fitness goals. And of course, as you're doing these exercises, if you're, being diligent with your 60 to 80 Kegels per day and you're, training in various different ways and you're still having issues, at that point, we would recommend seeing a pelvic health physical therapist because they may be able to help kind of do a deeper dive as far as what's going on with the pelvic floor muscles and why you're not getting better with doing the Kegels. The other important thing to keep in mind is Kegels aren't for everyone, right? So we talked a little bit about muscles aren't just for strengthening. So sometimes as our muscles are healing, for example, from a vaginal delivery, sometimes the muscles can actually heal a little bit too tight and they almost rebound and need to be lengthened. So we would say at that point that, Kegels would be, possibly contraindicated for you or certainly a precaution. And some signs of intolerance to Kegels, things that we would say make sure that you discontinue Kegels would be if you are having any kind of pelvic pain with Kegels, you should discontinue them at that point. If you are leaking, if you have a new onset of leaking urine once you've started doing Kegels, you'll want to discontinue. Or if your leaking gets worse with doing Kegels. If you have a new onset of back or hip pain, or if you have increased pelvic pressure. Okay, so any of those signs of intolerance would tell us that you're either not doing Kegels correctly or that there's something else going on that you need to be evaluated for. So discontinue Kegels and talk to your doctor if any of those situations arises. And again, at that point, they may encourage a visit to a pelvic therapist, just depending on what's going on, to kind of assess what is going on. And of course, so looking at progressing back into exercise, so we hit our 6 to 8 week mark and you get the green light to go back to exercise, and it's of course so exciting, but you're not sure where to begin, and maybe you're doing something with pretty high intensity beforehand, or maybe you were doing low intensity stuff before pregnancy, and it's still, even that feels difficult to go back to. Some ways that you can start to kind of ease back into your regular exercise program would be, of course, start with your Kegel program. So you want to start with your Kegel program to regain strength and motor control of your pelvic floor muscles. Think of it as just kind of waking those muscles back up after the delivery. You can work on your pelvic brace, right? So that's where we Kegel and contract our abdominals with it. And you want to get used to moving again. So you can certainly do modified workouts in a class setting. Just being very, very careful to listen to your body. If it feels too hard, it may be ask the instructor for a modification. And in terms of looking at returning to running, jumping, heavier weightlifting, those are all things that you would want to start looking at 3 months postpartum. So from 6 to 8 weeks up to 3 months, you really just want to look at, focusing on your pelvic brace, your Kegels, regaining that strength and awareness, and focusing on kind of just getting used to moving again and getting that pelvic floor activated again. And then you can start to look at the more intense movements once you've hit that 3 month mark. A couple of other Hogue postpartum classes that the pelvic health program does offer that can help to kind of bridge that gap would be what you need to know about diastasis recti, how to safely strengthen your core postpartum. So in that class, we talk about how to know if your core is ready to go back to high intensity exercise, and some things that you can do in the interim when you're not quite ready for the super high intensity that you were doing before. What can you do in the meantime to get yourself ready? And then another class that our team offers is called the pelvic floor and high intensity exercise. So that's when we go over really specific movements, working with kettlebells, weightlifting, squats, jumps, jump rope, all of that stuff that can place a lot of demand on the pelvic floor, and how you can kind of safely integrate back into that in the postpartum phase.
All right, so we're here, home stretch. Our last topic is regaining intimacy. So delivering a baby, whether it's vaginally or by C-section, can cause changes within the pelvis that can make sexual intercourse uncomfortable for a little while. However, don't ignore if the pain lingers, as much as it is a sensitive topic to discuss. Informing your healthcare provider and getting help will result in a smoother recovery. So I want to touch on why it can be uncomfortable. If you experience painful intercourse, there could be, multiple causes. So some of them would be insufficient arousal, vaginal lubrication causing friction, hormone changes, hypersensitive episiotomy scar, pelvic floor muscle quote-unquote trauma from delivery. Pain can arise from muscle and nerve changes. Sometimes, if you've had some pelvic girdle pain, like back pain, sciatica during the pregnancy, you can have lingering issues. And what that does is maybe positions of intimacy bother you a little bit, and then you guard. Emotional changes, the pain spasm cycle, all of those can cause some pain with intercourse. So typically, when we see pain, we're looking at a tight pelvic floor muscle. And if you just leave that alone, sometimes then if you engage in intercourse, then you have pain, your body's gut reaction would be to protect, and so it'll tighten out of fear, and then subconsciously the next time it's just going to contract again, spasm, guard, and so it becomes a vicious cycle. So let's just try and address that right away. We'll give you some tips here because you've already learn some of these things. I'll show you some scar tissue techniques. So if it is because of a scar, we can massage that scar. We can stretch the pelvic floor muscles. Again, a lot of times pain happens because they are too tight. And so the things that Christine talked about in terms of perineal massage, all those apply at the moment. We get questions as to, hey, I had a C-section, I didn't even deliver vaginally, why am I here having painful intercourse? Well, sometimes, like we talked about, that imbalance in the core, if your abs aren't working quite right, your back is strained, maybe this is your second pregnancy and you just haven't rehabbed your core back, then what you end up is a dysfunctional, hypertonic, overused pelvic floor that needs some relaxing. We also want to stretch surrounding muscles, again, similar to that relaxation piece where we're doing those ball circles, stretching your hips, your hamstrings, your inner thighs, all of that can help with pelvic floor relaxation. Practice those imagery in terms of relaxation, opening the pelvis, inverted umbrella, all of that stuff. Address muscle imbalance. Again, from a symptom standpoint, we're looking at, okay, I'm going to massage my pelvic floor muscle so that it's flexible. Now it's not to get the baby out, but now it's to get your husband in. So now we got to get flexible in that area. Address the imbalances in the core. So if your abs need some work, your hips need some work, we got to strengthen that for a long-term solution. And then in some cases, of course, medications, physical therapy, and counseling are needed. Just keep in mind, advances in neuroscience actually supports a multifactorial, multidisciplinary approach to this. We're looking at the whole person versus just the issue or the pathology. So our brain is a powerful, important sexual organ, and so it looks different for everybody, right? How is your stress managed? It's we joke around, men will want to have sex to release their stress, and then women want to not have stress before they want to engage in intercourse. And how is your stress managed? Am I worried about the baby waking up? Is everything ready? Am I sleeping enough? Am I eating enough? Am I getting enough time for arousal? And some of the studies there show it can take 30 to 40 minutes to even get aroused. And so just making sure we address all of that stuff to make sure that you're addressing the whole person in terms of getting back into intimacy. All right, so that kind of wraps it up for our presentation. We're gonna just do a little summary and then answer some questions and do a demo. We hope we've given you some information to help improve your well-being around these most intimate topics. I think, the most important message here is self-care is important. Start with the strategies that you've learned here. Watch for the signs of intolerance that Christine had mentioned. And if you need, then engage with a conversation with your physician, get some help, find a pelvic PT. It is a growing field. There's a lot of us out there. We hope to see you at our center if you need help. And just find one that supports you and your goals. And lastly, everyone's timeline is different. It's gonna look very different for everybody. And so just, honor your new body and the time it takes to relearn it and heal so that you can do the things that you love.
Excellent. So as Kathleen mentioned, we will absolutely go through some of the demonstrations of some of the stretches and the basic core recruitment exercise, but we did have a few questions from those of you watching that we wanted to touch on before we did that. So the first one was if we can share these slides. Absolutely. We just talked with our team, and if you go back to the class description where you originally signed up, the slides have been posted there now, or they have not been posted there now, but they will be later today. So you'll be able to go back in and you'll be able to download our presentation from today. So absolutely. Someone else asked if we could demo the basic core recruitment activity. Absolutely. Yeah, we'll demo everything that we kind of went over that would be better served with a visual demonstration. We have two other questions here. So this first one regarding painful intercourse was, do I tell my gynecologist about painful intercourse? Absolutely yes. So whether you're pregnant, whether you're postpartum, whether you're thinking about becoming pregnant, intercourse should never be painful. There are times that it may be uncomfortable, but it should never be painful. And it's absolutely something that you should let your gynecologist know if you are experiencing pain with intercourse. If you're pregnant and it's painful, it could signal, as Kathleen mentioned, typically when someone tells us that sex is painful for them, we think, okay, pelvic floor muscles might be tight. And if you're pregnant and hoping to have a vaginal delivery, that's important to know ahead of time, because we definitely want to work on stretching and lengthening prior to the delivery. So absolutely yes, without any other information, definitely let your gynecologist know if you're having pain with intercourse.
All right, next question. I just had a C-section in March. What kind of exercises do you recommend that I do? I've been walking outside but still feel pain from the surgery. So with a C-section, when somebody comes in, it depends, are you just looking to strengthen, or you're saying there's pain? If there is pain, then we suspect either there's scar tissue adhesions. So it's not so much exercise, but I would massage your scar area. I would massage around your abdomen area. Maybe your abs are starting to get a little tight around in there. It depends on where the pain is. I'm assuming it's in the abdominal area. I would stretch your hip flexors, psoas, quads, all of that stuff, and walking is great. And then once the pain is subsided, then that's when I would slowly introduce some of the basic abdominal exercises. So you would start with the basic core recruitment, like Christine had mentioned, and then build from there. A lot of times, in March, I don't know if you've engaged in some other activities too. If you exercise too soon, it may be that your abs are firing too much, or maybe you're tight around that area. So I would scale that back, focus on stretching and massaging in the area.
We had another great question come in, and it was, should I keep doing Kegels up until delivery, or should I focus more on relaxation and stretching closer to your due date? Really good question. Thank you to whoever asked that. Kegels are something that we want to focus on in the first and second trimester. And as we shift into the third trimester, and certainly by 30 or 32 weeks of pregnancy, we want our focus to be on stretching and relaxation. So at that point, we're working on the pelvic bulging exercise. At about 6 weeks out, we want to work on the perennial massage and stretching. And then as we move into the third trimester, we really want to focus on some of the pelvic opening stretches that Kathleen and I will demo shortly. So yes, really great question. Again, less of a focus on Kegels in the third trimester and more of a focus on that relaxation and stretching. Yeah, excellent. I'll give you one.
Is sex safe if I'm already starting to dilate? I would say
OB.
OB. It's a question for your OB. It's hard to say because we don't really know what the situation is. At this point, you're going to see your OB every week. So we're not in a position. It's out of our scope.
Mm-hmm. Yeah, good question though. This is a good kind of biomechanics one. So what if my thumbs can't reach the perineal area? Definitely something that can happen, especially if you're much, much further along or really approaching the due date. So a few different things. You can try it semi-reclined. You can also try it on the toilet if your hand can get around your belly. If not, you can definitely have a partner do this. You would just have their thumb go in place of your thumb. So can definitely kind of review that part of the slideshow with your partner at home, and they can help you out with that. Any other tips for that?
Yeah, a lot of times it's nice to have a partner do it, because then you can focus on relaxing, in that area. Because there's a part of it too where it's retraining. That pressure in there, you're trying to train your body to relax into that pressure. So sometimes it can be hard when you're applying the pressure and you're trying to relax too. So it's good if you can have a partner do that for you.
Excellent. All right, I believe that was all the questions that we had. So Kathleen and I are going to demo some stretches for you. We've been able to maintain this wonderful 6 feet of social distance between us, but we'll have to get closer than that for our demo here. So we're both going to put our masks on.
All right, so we'll start, we could start with just the relaxation piece, ball circles, and that pelvic relaxation slide. We talked about ball circles, child's pose, squat, and happy baby. All right, so ball circles, what we mean by a ball is having a little birthing ball right here. So Christine's gonna sit on that. our patients and ourselves, we love the ball here because it's nice and you can get feedback really. You can even do some of your Kegels here for that awareness, doing a Kegel here and then relaxing, even practice bulging in here. It's good feedback because there's that ball there. Next, we're gonna do pelvic circles. So she's gonna go just swing her pelvis clockwise and counterclockwise. Now the goal of this is for relaxation. So this is the pelvic mobility piece. So she's not really tightening her core and then doing these motions. So she really is just trying to improve the mobility in that general area. All right. And then we're going to get into squat. So I'm going to pull this away. And Christine's going to do a squat. So in this position, so we like it because it does stretch your pelvic floor muscles. So going back, right, to this anatomy, so we're trying to stretch this whole pelvic area, and so this position does exactly that, where her buttocks are spread out, and she's leaning forward and trying to stretch that area. Word of caution though, not everybody is comfortable in a squat position. So if you're struggling to stay in this squat position, then you may want to try different positions, because then if you're just struggling, you're probably tightening and not stretching. So a squat is also just like child's pose. So if you've ever done yoga, so the child's pose is this position, right? And she could practice her breathing in this position. And imagining, so right here in the pelvic girdle, right, so she's here, I'm imagining opening my sit bones, tailbone and pubic bone away, sit bones apart, deep breath. Inhale, again, your diaphragm and your pelvic floor has this rhythm. So inhale, your lungs fill with air, your diaphragm comes down and your pelvic floor comes down. So think about an inverted umbrella, opening in that pelvic area. Nice long breaths. Another version of this would be happy baby. And so it just is like child's pose, except, oops, run that, yeah. So except you're just laying on your back. So a lot of people find, these positions to be comfortable. Definitely can modify, definitely can have your husband, or partner help you in getting these stretches there. Okay, I'm gonna keep you in this position. And one of the things, we've talked about is, hey, stretch your hips, stretch your buttocks. Why? Again, as you deliver, so here's the pelvis, your hamstrings attached to here, your inner thighs attached to here, your buttocks attached to your tailbone. And so when it's tight in that area, then it's having some trouble into opening. And so basic hamstring stretches, you guys might be familiar with these things already, but definitely, stretching those hammies would be great. Stretching your glutes, so we'll get into figure 4, right? So you could stretch your glutes that way. Partner can help bring this. You're going to be a little limited because of the belly. That's okay. You could sort of bring that knee towards the opposite shoulder. You could stretch your inner thighs, so doing like a butterfly stretch like this. So caution, if you have any pelvic girdle issues like pubic bone pain or anything like that, you probably don't want to do a lot of these separation. All right. In terms of stretches, we've talked about stretches after like postpartum, feeding a lot, doing a lot of, baby care tasks. We like an open book stretch to open up the chest area. So Christine's going to lay on her side. Scoot this way a little bit. Yep. There you go. And then she's going to have her arms this way, like the pages of a book. And then she's going to open up. Yep. I'll make it work. And what you should feel is a stretch around that chest area. Rotation is really good. You don't want to get stiff, in your trunk either. and then come on back, and then you do it on the other side. So most stretches you should hold for 30 seconds to be effective. You can go longer, but minimum of 30 seconds. If it hurts though, then you can obviously do shorter bouts. All right, we'll do a doorway stretch. Actually, you know what, while you're there, there's child's pose 3-way on there. So child's pose 3-way would be child's pose, and then she's gonna reach onto one side. So her arms are going to the right, and then she's gonna sit her left buttock towards her left heel, and what she's gonna feel is a stretch in this area here. So you're gonna carry the baby a lot, and so your lats are gonna get tight. So this is a good stretch for that. And then she's gonna go the other way. So that's the 3rd way there. Again, sitting her buttocks this way, arms that way. 30 seconds on each. All right, and then we're gonna do a doorway stretch. It's hard because we don't have a door, but I'm gonna pretend I'm the door. And then she's gonna put her arm there and then lunge forward. Again, this is a pec stretch, so a chest stretch to open you up after all of those activities. Good. And then the last one would be sun salutation on there. It's just good as a postural exercise. You're gonna start with your hands right here. You're gonna take a deep breath in, arms up, overhead, and then exhale. Come on back down, and you're squeezing your shoulder blades when you come back down. Inhale up, and then exhale, squeeze those shoulder blades, and come back in. All right, so I think that's it for some of our stretches.
Basic core recruitment too.
Yeah, so let's go over, so we'll go over basic core recruitment. So we'll start with a Kegel. So you're gonna stand up, have your hands right here like you had pockets. So you're gonna start to take an inhale, and then you're gonna exhale, you're gonna Kegel. So stop gas from coming out, zipper up the labia, draw that Kegel inside of you, and then draw your belly button towards your spine. So in, hold, keep breathing, and relax. So that's if you're holding it. And then if we're gonna start to try and integrate it into function, so let's say this was a stroller. I'll give you my baby. So Christine will say, okay, I'm gonna, pick up the baby, any lift, so we like the squat or we like a, lunge. So what she's gonna do is she's gonna come down, and you're gonna exhale, Kegel, and pull your deep abs in, keep the load close to you, and then pick up. So that's what we mean by, trying to do your squat. This could be a stroller, could be a crib, could be, any surface, and then put the baby back down. Yep. So what else? Kegel progression, we say Kegel and pull your abs in on exertion. So if she were to do a squat, just a basic squat, it would be so laying flat while you're pregnant is okay if it is, well, it kind of depends, yeah, or is this just after birth? The stretches that we did was a combination, actually. So the first few ones, so we said ball circles, child's pose, squat, and happy baby. So those are your 3rd trimester. So happy baby is the only one that you're on your back for, and you're only there for 30 seconds, if any, so that's okay. You can even be on your back and put a pillow under your left side so you're not fully on your back, so that's okay. Everything else in terms of, the hamstring stretches, the glute stretches, all of those things, supine could be done, after the pregnancy, but before pregnancy, I guess, good point and good question. We were showing you a lot on your back, but those exact stretches could be done standing in terms of, hamstring stretches or glute stretches this way. But in the clinic, we have had our patients, do these stretches on their backs up to their third trimester, we just put a pillow underneath, one side so they're not fully on their back. Everyone's different, so I would just, if you get dizzy, then I would stick to standing, sitting. Yeah, so my pubic symphysis area has a lot of tenderness during pregnancy. How do I stretch my pelvis while minimizing pain? So that's where it gets tricky, actually, because for pubic symphysis diastasis, we don't like for people to stretch out. So that is a case where we don't recommend a lot of these stretching because you want compression, really. So when a patient comes into us, says, I have some pubic symphysis issues right here, then I would put them in a belt. I would limit their walking, I would limit their stair climbing, I would limit, activities where they're squatting or everything that we did pretty much. So how can I stretch my area? It would be a massage. It would be, soft tissue work. You could get a prenatal massage, have your partner help you in terms of, massaging your hips, your pelvis, and all that stuff.
And definitely in that case too, some of the other exercises that we showed, like working on the breath sounds, the ball circles, all of that where you're actually just kind of actively relaxing the pelvis would be okay. You would just want to avoid things where the legs are splayed. So like the butterfly would be challenging, happy baby would be challenging because the legs are coming apart. But you could definitely try the work on the exercise ball would be helpful.
Yeah. Even when patients say, they're doing some prenatal yoga, a lot of those stretches, are splaying their legs open, so we actually tell them to hold off on that. All right, I need to demo a scar massage. So I would say, if this was the perineum, so most of us will have a scar here or a C-section scar here. So you definitely want to make sure everything's healed, so you get clearance. The doctor has looked at it and said, okay, there's no infection, everything's healed and good. Wash my hands. I'm going to use the pad of 2 fingers here. I'm going to hook it a little bit. So if the scar was this line right here, I am directly on the scar, and I could also go a little bit above and below the scar. So one would be a push-pull. So I'm just going pushing and pulling, and what you'll actually feel is that some of the areas here will have more tightness, more pull or tug than the rest of it. So you might want to go push and pull and hold for about a minute, and then push and pull and hold for about a minute, and then go the length of the scar. You could go do little circles. Same thing, if you feel like, ooh, this one's a little bit tight, I could just, focus on that a little bit. As you get better, so this is more for a C-section scar versus the episiotomy, what you could do is start rolling. So what rolling would look like is I'm pinching, I know, and rolling. It's not comfortable.
This is the most intense.
And scar is, going to be a little painful. And why we care about it, especially for a C-section, is that if that adheres there, then your core just doesn't, your abs don't activate as well as they should. And for aesthetic reasons too, our patients would come in and say, it just doesn't look right. This is aggressive. And then another one would be I could pinch and then kind of roll. So those last 2 ones are aggressive. Most people, will say, no, I'm good. So they just do the scar massage with a push and pull, and that's totally fine. Anything else that we missed? I think that's it.
Doesn't look like we've had any other questions either. So thank you guys so much for joining us this afternoon. We look forward to seeing you at one of our Hope facilities soon, and everyone have a happy and healthy